welcomes you all in our sixth talk of iLEAPS Global Colloquium Series 2026. So, with a very good response received from earlier episodes from 2022, 2023, 24, 25. So, we have continued this series in 2026 also. So before I go further, firstly introduce what the iLEAPS is. So iLEAPS is Integrated Land Ecosystem Atmosphere Processes Study, which is a global research project of future Earth. iLEAPS provides understanding of how interacting physical, chemical, and biological processes transport and transform energy and matter through the land atmosphere interface. The prime purpose of this colloquium is to introduce the scientific community with the distinguished and significant work of eminent scientists from different parts of the world. It is a very bright opportunity, particularly for early career researchers, to interact with the distinguished speakers and establish the bridge between the ideas and knowledge through this platform. So our today's speaker is Dr. Caredy Wright, who is Chief Specialist Scientist, Environment and Health Research Unit, South African Medical Research Council, South Africa. She heads the Climate Change and Health Research Program, where her work focuses on the intersection of climate change, air pollution, and public health. With over 2 decades of experience, Professor Wright has pioneered research on environmental risk factors affecting vulnerable populations, including children, women, and low income communities in South Africa and the continent. In her early career, she conducted research on the effects of solar UV radiation on health, including UV dosimetry and exposure studies. She has published extensively in peer-reviewed journals and contributed to global assessments such as Intergovernmental Panel on Climate Change (IPCC) reports. Her research addresses critical issues including household air pollution, water and sanitation, thermal comfort in low-income housing, and health system resilience to climate-related shocks. Professor Wright also plays a key role in advancing policy development, serving as an advisor to government, international agencies, and civil society organizations on climate change and health. In addition to her research, Professor Wright is committed to capacity building and mentorship, training the next generation of environmental health scientists in Africa. She is recognized internationally for her leadership in integrating scientific evidence into policy and practice, particularly in the areas of air quality management, climate resilience, and health equity. So today she will talk about exposome science unmasks opportunities to address climate change, air pollution, and public health impacts, where her presentation explores about how an exposome approach revealed previously hidden pathways, linking climate-related hazards, air pollution, and uh, disease burden, particularly in vulnerable populations. So I again welcome Dr. Caredy to put a light on this very important and significant topic. Dr. Wright, the floor is all yours.
Thank you very much, and I'll go ahead and share my screen.
Dr.
And
Caredy, we are recording this session. I hope you don't have a problem in this.
that's fine, no problem.
Thank you.
Of course. It is a pleasure to be here with you today to discuss a topic that I really believe will fundamentally transform how we understand and respond to environmental health challenges in coming decades. I just make sure my slides are moving. So, climate
Yes.
change and air pollution, thank you. Climate change and air pollution are among the greatest environmental threats to human health in the 21st century. Here we're looking at all of the things that encompass environmental health itself. Together, they contribute to millions of deaths around the world every year, placing enormous burdens or pressure on our health systems and disproportionately affecting the most vulnerable members of our societies. Yet, despite their interconnected nature, climate change and air pollution are often studied, monitored, and managed as separate risks. Climate scientists focus on heat waves, droughts, floods, and extreme weather events. Air pollution scientists focus on particulate matter, ozone, nitrogen dioxide, and other pollutants. Public health practitioners often respond to the consequences after health impacts have already occurred. However, real world exposures do not occur in isolation. People do not experience heat alone. They do not experience air pollution alone. They experience a complex mixture of environmental, social, behavioral, and biological exposures that interact over time to shape a health outcome. This is where exposome science offers a very powerful new way forward. Today, I will discuss how an exposome approach can reveal previously hidden pathways linking climate related hazards, air pollution, and disease burden. How can exposome science improve our understanding of population vulnerability? And how can it help move environmental health science from reactive observation to proactive prevention? What is the exposome? The term exposome was introduced by Christopher Wilde in 2005 as a complement to the human genome. While on the right hand side, the human genome captures our inherited genetic makeup, the exposome represents the totality of environmental exposures that an individual experiences throughout life, from conception all the way through to death. Importantly, the exposome includes much more than only environmental pollutants. It includes physical exposures such as heat, cold, solar ultraviolet radiation that I studied when I was much younger, and noise pollution, chemical exposures like air pollution, pesticides, and heavy metals, biological exposures, including infectious agents and microbiomes, social and economic conditions such as poverty, education, housing, and even your occupation, social and behavioral factors, including diet, physical activity, and your lifestyle choices. The exposome therefore recognizes that health outcomes emerge from the interaction of multiple exposures over time. Instead of asking, what is the impact of heat or what is the impact of air pollution? The exposome asks, how do multiple exposures combine to influence health over the life course? This shift may seem subtle, but it fundamentally changes how we think about disease causation and prevention with a view across the life course. Why climate change requires an exposome approach? Well, climate change is often described as a threat multiplier. It amplifies existing risks rather than creating entirely new ones. Here we are having a look at the complexities around increased pesticides and herbicides used, linked with CO2 emissions, leakage of chemicals through spillage, changes in temperature affecting mosquito and vector distribution, increased exposure to things like PAHs, and all of the links to potential health outcomes at the bottom. Consider a heat wave, then. Not everyone experiences the same consequences of a heat wave. The risks depend on things like age, pre-existing disease, housing quality. Here, in a settlement in the Northern Cape in South Africa, people's beds are outside. They sleep outside to try and feel cooler at night because indoors is too hot. Housing quality in cities, oftentimes not ensuring optimal thermal comfort. Access to cooling being something that is not always present. Occupational exposures are also present health consequences together with air quality. Here we see a city heavily polluted with air and transformation after this particular dust air pollution mix event. The risks also depend on socioeconomic status and access to healthcare. A construction worker in the city of Johannesburg, a farm worker in Italy, an elderly woman living alone in Paris may experience the same temperature but face very different health risks. The exposure environment matters. The exposome helps us understand these interacting vulnerabilities and helps us identify who is at greatest risk and why, and who we should work to protect first and why. One of the most important contributions of exposome science is its ability to reveal hidden pathways connecting general external exposome, specific external exposome, and internal exposome, as well as all the environmental exposures. Climate change and air pollution are deeply interconnected. Rising temperatures can increase ozone formation, for example. Wildfires generate massive amounts of particulate pollution. Droughts increase dust exposure. Changes in energy use affect both greenhouse gas emissions and air quality, especially in the breathing zones of people's homes. These interactions influence health in ways that are often overlooked. Let's look at an example. During the early this is earlier in the 20th century, but it's probably was very similar during the 2003 European heat wave. Interestingly, there's a heat wave occurring right now in Europe. Approximately in 2003, approximately 70,000 excess deaths occurred. Initially, these deaths were attributed to primarily to extreme temperatures. Subsequent analyses then showed that many affected regions in Europe simultaneously experienced elevated ozone and particulate pollution concentrations. Heat and air pollution interacted to increase cardiovascular and respiratory stress. People were not exposed to a single hazard, but to a combined environmental burden. This is precisely the type of complexity that exposome science seeks to understand. Wildfires provide another compelling example. Across Canada, the United States, Australia, and increasingly parts of Africa, wildfire events are becoming more frequent and intense. When wildfire smoke affects communities, people are not only exposed to particulate matter, they may also experience extreme heat, evacuation and displacement, loss of income, mental health, mental health stress, reduced access to healthcare, and disruption of social networks. Research following the major wildfire events in both California and in parts of Australia have shown increases in respiratory disease, cardiovascular illness, anxiety, depression, and post traumatic stress disorder. The health impacts arise from the cumulative exposure experience rather than a single pollutant. Again, the exposome provides a framework for understanding these interconnected pathways. If we turn to a case study closer to home, here in South Africa, we have a particularly important context for exposome research. Many communities in a highly polluted part of our country face multiple overlapping environmental challenges. In the air pollution priority areas in the interior of the country, known as the Highveld, the Vaal Triangle, and the Waterberg-Bojanala priority areas, air pollution remains a major public health concern. In fact, this is the case where the very first incident of the communities with NGOs took the government to the Constitutional Court for the breach of the right, the constitutional right, to an environment that is not harmful to one's health. At the same time, in this area where coal-fired power stations drive the electric grid of our country, climate change is increasing exposures to heat extremes, drought, and severe weather events. Individuals living in these areas are often experiencing air pollution concentrations well above World Health Organization air quality guidelines, heat exposure, energy insecurity, or even energy poverty, poor housing conditions, occupational risks, many of them are actually working at the coal mines, as well as limited access to healthcare, especially in areas where the healthcare infrastructure is weak. Traditional studies may have examined these factors separately. The exposome recognizes that they do in fact interact. For example, heat can increase physiological stress caused by air pollution. Poor housing can increase indoor heat exposure. Economic disadvantage can reduce adaptive capacity.
Dr.
Understanding all of
Kennedy,
these, yes,
sorry to disturb. I think the slide is not changing.
sorry, there we go.
Yeah, now it's fine.
Okay, thank you. Traditional studies would have examined these factors separately. However, the exposome considers that they interact. So, a major strength of the exposome approach is its ability to identify vulnerable populations. Vulnerable populations are across the life course in children, including children, pregnant women, older adults, individuals with chronic disease, outdoor workers, residents of informal settlements, and especially socially and economically disadvantaged communities. Here we have an example from the city of Baltimore. I visited the city many, many years ago and was intrigued how it houses some of the most prestigious universities in the world, yet faces some severe disparities, not only in health, but also in education and others. Another example closer to home for me is in South African classrooms. Research in South African classrooms have demonstrated that excessive indoor temperatures affect concentration, learning performance, and well-being. Similarly, studies in healthcare facilities have documented potentially dangerous heat exposures among patients and healthcare workers. All of these findings in classrooms or in clinics highlight how environmental exposures interact with social and infrastructural vulnerabilities. In this way, the exposome enables us to identify compounding risks much more effectively. So, perhaps the most exciting aspect of exposome science is its ability to integrate diverse sources of information. Today, we have unprecedented access to satellite observations, air quality monitoring networks on the ground, weather and climate data, electronic health records, GIS, mobile technologies, wearables. Many, many people are now wearing and holding devices that bring copious amounts of data to us, as well as artificial intelligence and machine learning. And when these are all combined, it really helps us to characterize the exposure environment at high spatial and temporal resolution. So instead of just looking backwards, studying exposure retrospectively, we can begin to anticipate future risks. And this really creates opportunities to transform public health practice. Historically, environmental health research, especially environmental epidemiology, has largely been retrospective. We identify associations after harm has occurred, but the exposome offers the possibility of moving forward toward prediction and prevention. Imagine a system, before I show you the next slide, imagine a system that's capable of identifying when air pollution coincides with, when high temperatures coincide with high air pollution levels, when vulnerable people are likely to be affected most. High service demand is expected to increase in our primary healthcare facilities, and when preventative interventions should be activated. Such systems could support public health decision making before illness occurs, and this would really represent a major a paradigm shift for us. Here's an example recently launched here in South Africa um, by the South African Medical Research Council, the National Department of Health, the University of Pretoria, and the South African Weather Service. It's important to mention all of these entities because it takes multiple groups and data sets to come together to put information in one place in order to understand the connections between climate, air quality, and health. A practical example or application of exposome science is precisely this, working towards the development of an integrated early warning system. In this surveillance platform, it's visualization, but many health countries are really working towards early warning systems, not only monitoring and visualizing, but looking towards understanding, especially things like outbreaks. The next generation of systems like these will integrate multiple hazards simultaneously. For example, weather forecasts, air quality predictions or projections, as well as including social vulnerability indicators. These systems could help identify communities at greatest risk and trigger targeted responses. So here's an example of a targeted response for school-based interventions. We can look at this from an individual behavior and institutional action, things like ensuring there's hydration, improving heat resistance of school clothing, changing school curricula and extramural activity scheduling, and having low cost interventions for cooling during intense periods of stress, such as examinations. Changes to the built environment. So, having a safe water, especially during droughts, water that's actually available in the buildings and not in a standpipe, one tap standing alone in a field nearby. Ventilation, ideally air conditioning, if we can do that using green sources. There's been great work to look at the effect of white thermal paint on roofs and exterior walls, insulation in ceilings. Maybe we need to have cooling rooms where people can go for some time each day to cool down, as well as shade and green initiatives. At the highest level, considering government actions, thinking about standards for building standards for environments such as schools, where young people are exposed to temperatures that really do have adverse impacts on cognition as well as physiological health. And perhaps we need adolescent specific uh, things, aspects to consider in our adaptation guidelines, since this age group is fairly different to others, particularly when it comes to behavioral uptake. And then finally, thinking about promulgating policies to reduce carbon emissions in these environments. Other settings that could benefit from this kind of intervention in a quite holistic, multidimensional approach would be public health advisories, community outreach, health care resource allocation, and occupational health protection. Surely, by supporting anticipatory action, exposome informed systems can help reduce health impacts before they occur. We need to reflect on the fact that the exposome is extremely important for low and middle income countries where we experience multiple environmental and social stresses simultaneously. Climate change is anticipated to intensify these challenges that we are already facing while we are on a development trajectory to improve quality of life for our populations. Many countries are rapidly expanding things like environmental monitoring systems, health information monitoring systems, as well as digital infrastructure. This creates opportunities to really try and develop locally relevant exposome approaches that reflect the realities of vulnerable groups in communities. Importantly, low and middle income countries, such as those in the Southeast Asia and Africa, have an opportunity not simply to adopt exposome science, but to try and help its future. Many of the world's most complex environmental health challenges are already being experienced in our parts of the globe. And we can play a leading role in developing innovative solutions that are globally relevant. The value of the exposome and exposome science really lies in its ability to inform action. An exposome perspective can support things like climate resilient public health planning, air quality management and urban design, housing interventions, occupational health protection, health equity interventions, and climate adaptive policies. So when we identify where multiple risks converge, policymakers can then be informed on how best to prioritize interventions, possibly multiple pronged interventions that will really have the greatest impact. This is especially important in low resource settings, particularly those in low and middle income countries. So, in conclusion, first, climate change and air pollution should not be viewed as separate environmental threats. They interact with each other and with broader social, behavioral, and biological factors that influence health. Secondly, exposome science provides a transformative framework for understanding these complex interactions across the life course. It allows us to uncover hidden pathways linking environmental change and disease burdens, particularly among vulnerable populations, at population scale. And third, exposome science has the potential to transform environmental health research and practice. By integrating climate, environmental, and health data, we can surely improve risk projection, strengthen our early warning systems, support climate resilient public health policies, and advance equitable adaptation strategies. Most importantly, the exposome does offer an opportunity to shift from reacting to environmental health crises after they occur to preventing them before they happen. In an era of accelerating climate change risks and environmental health risks, surely we want to push the needle back on these things. Finally, in this environmentally complex world, this may be one of the most important scientific transitions we make to embrace the idea of the exposome and exposomics in understanding and protecting human health. I conclude with a slide illustrating some of the ways that you can get involved. Both ISES has a theme on exposomes this year for their conference. If you're interested in the Global Exposome Forum, sign up for the Exposome Network newsletter. And then there's some examples of projects and networks that exist through both Europe and the United States. Thank you.
Thank you very much, Dr. Kennedy. I open this session for the questions. If in the audience there are some questions, you can either write it in the chat or you can directly open your mic and then you can ask the question. There is one question in the chat. Are you able to read it, Dr. Kennedy?
I can. Yes, thank you so much for this first question. I am unable to see. Oh, thank you, Ronak Rajama. I appreciate that. And good to be brave and ask a question. I always appreciate questions. So many climate adaptation measures, such as urban greening and improved urban design, can both influence heat exposure and air pollution. Has exposome research identified which interventions provide the greatest co-benefits for reducing both climate-related and air pollution-related health risks? I love this question because about a month ago, I was in the city of Cape Town and I was giving a course to frontline health professionals, so emergency medicine service response and other government officials. And we were talking about co-benefits. And because we were in Africa, I I said to them, well, I know that in the likes of, European or American cities, we are often told that ride a bike, go and ride a bike, don't drive a car. Uh, if you must take public transport, but ideally ride a bike to and from where you need to get to because it will reduce emissions and it's good for your health because you are exercising. But the reality is that that co-benefit switch is not one that would apply in an African city. I think in many Indian cities that might be the case too, and other low and middle income countries around the world, because one individual, we'd have to get a whole lot of people to ride bikes. And unfortunately, there are so many other sources of air pollution besides traffic in many of these low and middle income cities that we would be exercising and riding in polluted air. So, my challenge to the class who I was working with was, well, what is the low and middle income equivalent of this co-benefit action of riding a bike to reduce emissions that affect greenhouse gases and air pollution and also improve your health? And until now, I don't think we have one. In fact, one of the class students sent me a little a reel with a group of people sitting in a bus with their feet stuck out the bottom and using their feet to, move the bus forward, and the bus was air conditioned. I mean, of course, that's hilarious, but not a solution to this problem. So no, I don't think exposome science has got us to the point of identifying co-beneficial interventions yet. I think it will help us get there, but it will need to be through lived experience and co-design and understanding what real people in this world are doing to make a difference. Um, and I think if anyone is doing research nowadays that isn't engaged research meaning the research that involves communities and members of society, then you're falling short because the answers are really lying among what's happening on among communities already.
Thank you, Dr. Kennedy. I hope, Ronak, you got your answer. Any other question from the audience? So I think there is no question, Dr. Kennedy. So thank you very much again for such an interesting and thrilling talk. So now I like to highlight some of the points of the speaker before I close this session officially. So, Dr. Kennedy Wright has started his presentation on exposome science, unmasked opportunities to address climate change, air pollution, and public health impacts. She has started her talk with the introduction of environmental health and about different factors that affect nature, climate, and environmental health and produce various risks. She explained about the general impacts of air pollution on human health. She introduced exposome science that brings new aspects in air pollution, health, and climate science. She introduced about the standard and basic fundamental of exposome, that is what the exposome is and how the exposome science is contributing in environmental health. Exposome includes chemical exposure, biological exposure, social and economic conditions, behavior conditions, and physical pollution science. It affects different life ages also. Then she explains that why climate change requires exposomic approach. It produces potential health effects like cancer, vector-borne disease, fungal and bacterial infections, and respiratory illness. Then, housing qualities in cities are also one of the factors that affect the health conditions of the people living over there. And exposomes environment is very important for estimating the health risk. Then external factors or extreme events increase the climate change risk and consequently exposome risk. Wildfires, heat waves, or other extreme events bring environmental risk, displacements of people, health stress, social disruption of networks, and these causes consequently the impact on the human health and causes cardiovascular respiratory diseases due to exposure of air pollutants generated from these extreme events. Then she also highlights that air pollution becomes a big health concern. Exposome affects vulnerable populations like pregnant ladies, children, elderly, etc. Then she has given the example of the South African classroom where extreme indoor temperatures affect the health well-being. And that's why exposome science identifies the compounding risk. The general methods like satellite data, models, artificial intelligence, and machine learning helps to identify exposome science more clearly. In South African Medical Council that works towards the weather climate impacts on human health, air quality, and climate health linkages. Individual behaviors and institution actions changes to build environment, government actions to influence environmental condition so that the health of the individuals will be informed. Control measures will be needed to be co-designed with adolescents, teachers, caregivers, and other stakeholders to optimize social alter acceptability. She also explains exposome science approaches like monitoring weather and temperature, tracking vector biology, satellite and GIS methods, questionnaires and surveys. These all exercises help us to estimate health risk. Other approaches like air quality management, housing management can be the measures for the exposome science. And in conclusion, she explains that air pollution and climate change, they are not treated as separately, but they both are interlinked and can be treated as equally. Exposome science tells us specific external, internal environment, which tells us about the health risk assessment. The exposome has the capacity to reduce the health risk. And in the last, she declares that there is a conference on exposome next ISES 2026 theme, which is going to be held in Vancouver, Canada. And there are other networks also where you can and anybody can read about it, can connect with the about the exposome, that is exposome next newsletter. So I would again like to thank Dr. Caridi for sincere for paying the sincere thanks for her interesting talk and vivid description of the topic. We are also thankful for taking the time out from her busy schedule and accept our invitation to deliver this talk in our event. We would also like to thanks to the attendees who took active participation in this session. Last but not the least, iLEAPS and UKCH for giving this opportunity to conduct this event. Thank you very much again.
Thank you very much, Dr. Pallavi, and it was a real pleasure to be with you today. And I'm very grateful to meet all of you. Please do reach out if you would like to talk more about the exposome or environmental epidemiology. Thank you.
Thank you so much.
Thank you, and I'll stop the recording.
Thank you, Gary.